Welcome, and thank you for using Medical Indicators clinical thermometers. The NexTemp single-use thermometer has been used by physicians, hospitals, and clinics worldwide for over 20 years. Medical Indicators thermometers carry FDA and CE certifications and conform to product standards under ASTM E1299-96. Medical Indicators products are safe, accurate, and effective. This short presentation will discuss the proper use and handling of NexTemp single-use clinical thermometers. The NexTemp single-use clinical thermometer can be used for oral, axillary, and rectal temperature measurements. We will also review NexTemp's general product characteristics, including its safety aspects, accuracy, long shelf life, and excellent storage properties. Preparation is important. Always wash your hands before using NexTemp thermometers or any other medical device. Open the clinical box and remove one of the perforated strips of thermometers. Tear away one of the thermometer wraps at the perforation. Peel apart the wrapper at the end where it says open by the arrow. Pull the thermometer out of the package by the handle and discard the wrapper. Instruct the patient to open their mouth and then place the grid end of the thermometer far back into the patient's mouth under their tongue. The thermometer needs to be positioned in the heat pocket of the mouth, as indicated by the diagram on the left. Make sure that the patient's mouth is completely closed with the patient breathing through their nose. It is helpful to have the patient press their tongue against the thermometer during the measurement period. This helps the thermometer quickly warm up to body temperature. Begin timing the temperature. Wait at least 60 seconds before taking a reading. You may leave the thermometer in the patient's mouth for longer than 60 seconds if you feel that the patient is not making full contact with the thermometer. Generally, a 60 to 90 second period is optimal. If you require reading glasses to see the thermometer's small number scale, then have them out and ready for use. After at least 60 seconds has elapsed, remove the thermometer from the patient's mouth. Read the temperature immediately. The temperature will begin to reset itself in 10 to 20 seconds after it is removed from the patient's mouth, so it's important to read the scale right away. If the thermometer resets itself before you note the temperature, simply retake the temperature. Remember to use the same unit and repeat the instructions. To read the thermometer, remove the thermometer from the patient's mouth. Read the thermometer scale, noting the temperature indicated by the last black dot in the thermometer grid. The last black dot is the oral temperature reading. The thermometer displays the patient's accurate temperature using a grid of temperature dots. Each dot in the grid represents a different temperature and turns black when a specific temperature is reached for that dot. Each dot represents 0.2 of a degree Fahrenheit. The entire temperature range is from a low of 96.0 degrees Fahrenheit to a high of 104.8 degrees Fahrenheit. As the thermometer grid warms up, the dots turn black in the temperature sequence until the final and accurate oral temperature is reached. The black dot with the highest temperature number represents the patient's measured oral temperature. The three figures at the bottom of the slide illustrate how the thermometer dot grid appears using three different temperature readings. Please look at figure number 1 at the bottom of the slide. There are no black dots. This is how the thermometer will appear when it is removed from its package. Since the thermometer has not been exposed to temperatures of at least 96 degrees Fahrenheit, there is no reading, so all of the dots are green. In figure 2, the black dot with the highest temperature is located near the bottom on the left side. This temperature reading is 98.6 degrees Fahrenheit. For figure number 3, the black dot with the highest temperature is located near the top on the right side. The temperature reading is 101.2 degrees Fahrenheit. This illustration shows a close-up view of the temperature dot grid system. Each row from top to bottom represents 1 degree Fahrenheit. Each dot along the row from left to right represents an additional 0.2 of a degree Fahrenheit temperature point. The yellow numbers placed over the black dots show the 0.2 of a degree Fahrenheit increase for each dot as you read from left to right. The thermometer grid on the left reads 98.6 degrees Fahrenheit. The thermometer grid on the right reads 101.2 degrees Fahrenheit. As with all temperature grid readings, the black dot with the highest temperature represents the actual oral temperature reading. After you've read the temperature grid, make a written note of the patient's temperature if this is part of your protocol. Please remember that the thermometer will begin the process of resetting itself shortly after it is removed from the patient's mouth, so it's important to note the temperature when the temperature reading is present. If you need or want to retake the patient's temperature, simply put the same thermometer back into the patient's mouth and repeat the process. The temperature dots remain accurate with multiple measurements. When you are done taking the temperature and recording the results, discard the thermometer. NexTemp thermometers can also be used to take axillary and rectal temperatures. Axillary temperatures are performed by placing the NexTemp oral thermometer under the patient's arm for 3 minutes. Rectal temperatures require that a soft plastic sheath be used. The NexTemp oral thermometer is inserted into the sheath, then administered to the patient. To take an axillary temperature, place the dot end of the thermometer at the fold in the patient's armpit with the dot grid against the torso. The handle of the thermometer should point towards the patient's feet, parallel with the body. Instruct the patient to close their arm tightly to hold the thermometer in place during the measurement period. Wait at least 3 minutes before removing the thermometer. After at least 3 minutes have elapsed, remove thermometer and read immediately. If necessary, the temperature can be retaken using the same unit with the same patient. To take a rectal temperature, insert the NexTemp oral thermometer into the rectal sheath, with the dot end of the thermometer placed at the rounded end of the sheath. Insert the rounded end of the rectal sheath into the rectum until the dot grid and all the numbers are completely covered. Wait at least 3 minutes before removing the thermometer. After at least 3 minutes have elapsed, remove the thermometer and read immediately. We've discussed how simple it is to use NexTemp thermometers, just a few short steps to an accurate temperature. Place the thermometer under the tongue, wait at least 60 seconds, read and record the temperature. Properly dispose of the thermometer when done. NexTemp clinical thermometers are safe, accurate, and effective medical devices. They carry FDA and CE certifications. They are used by hospitals and clinics worldwide. NexTemp reduces the opportunity for germ transmission between people. NexTemp is accurate to 0.2 degrees Fahrenheit and never requires calibration or adjustment. NexTemp is available in both Fahrenheit and Celsius scales. NexTemp is completely safe and non-toxic for users. There are no chemical or contamination hazards. NexTemp is completely safe for the environment. There are no batteries, mercury, or other hazardous contaminants. NexTemp has no special storage or handling requirements. NexTemp is not damaged by the heat or cold. It maintains its accuracy in a wide range of conditions. NexTemp has a long life, 5 years from the date of manufacture. Thank you for your attention and for using Medical Indicators NexTemp clinical thermometers. For further information, please visit our website at www.medicalindicators.com or call us toll-free at 888-737-1601.